Well, and that's before the full-blown campaign has actually come about. I mean, you know, I don't think many in the community really understand or know about exactly what the rural residency program is and how we can help contribute to the effort. So that's why we're really doing these kinds of educational opportunities to share that information with our Big Island community. You know, just an anecdotal issue, which is, you know, really made my heart feel good, is that my neighbor in Volcano was driving by, and we were talking a little bit about healthcare, but he's a member of the Rotary, one of the Rotary clubs, I think in the morning club. And, you know, he told me that they did a fundraiser, I think it was a steak fry or huli huli chicken or something, and that they decided to donate the entire proceeds from that effort to this rural residency program. And so, you know, that really is an indication to me that there's growing knowledge about this, and that there's efforts, that just people are reaching into their own pockets to do this thing. So,
if I could mention some other examples of what you just said, another Rotary is having, it's a lunch or a breakfast. It's an event. It's going to be on Coconut Island, and all the proceeds from that event they're going to donate to the residency program. Nimmer Tamini, he is one of the co-owners of Atbara Chips. He's going to donate 10% of his sales from gift baskets and his store to this program. We had someone, an individual who lives in the community. A lot of people have called just stepping up to help, but it does come down to money. An individual called and said, I'd like to help. If you could get one of the docs to come speak at a cocktail party I'm having at my house, I'm going to invite people. They're going to write a check. It might not be a lot, but it's going to go to the pool. They're going to have that event. A lot of people are stepping up in creative ways.
You know, let me just echo what Russell said, because it is heartwarming. But it's not only heartwarming, it's sort of exciting. I mean, you know, all of these examples are just further validation of the need for such an essential service, you know, to our community. And therefore, I think we really appreciate the kind of efforts you folks are making, because I think right now, you know, when we first got wind of, you know, the kind of positive work you were doing, I mean, you know, Senator Kokubun, you know, for the Big Island Senate team led the way in terms of, you know, trying to draft a resolution so that we can work hand in hand with you. But maybe before we get to that, maybe you can set the stage for us a little bit more in terms of the kind of organizational efforts and the kinds of, you know, team building that you folks have already played a major leadership role in helping to set up.
I think there's been a tremendous effort amongst the Board of Trustees to really volunteer and try to look at different ways creative ways to fundraise, which we never did before. Dr. Santiago's husband, for example, Dr. Kevin Wilcox, he has stepped up to the plate, and he said, you know, wouldn't it be really nice if people don't, he doesn't matter whether it's $1 or whatever, whoever donates money to this cause, he will put out in the newspaper an ad and list all the people's name. And it's amazing, each week the list is growing bigger and bigger.
It is.
And you know, the amount of contributions that's coming in, it's going to be significant, because it's like, oh, that person donated. You know, if that person can donate and he feels that it's important, then maybe I should too, because, you know, I trust that person in donating that kind of money. You don't know how many people are donating what kind of money, but we know that the list is growing and each one is donating monies. But the amount is kept confidential. But I think his effort is just tremendous, because that came from his heart.
He's paying for the ad out of his own pocket.
I saw it in the paper. I thought that was terrific.
Yes.
That is so amazing.
So Lori, can you give us an idea about, you know, I know there are targets for the fundraising efforts.
Yes.
Maybe you can help us understand that better.
There's benchmarks of funds we have to raise, or else the program dies. It goes away. I have those here. By fiscal year 2009, it's coming right up in a few months, we need $50,000. We have in hand $18,700. By fiscal year 2010, we need $500,000. By fiscal year 2011, $525,000. And we have to meet those benchmarks or this program goes away. This is very grassroots what we're doing, but we're hoping the momentum, it's going to move. We're going to do it. We're not seeing this as something that's going to fail.
Right. And I think it's that kind of optimism actually that's very contagious. And you know, my understanding is just through discussions with, for instance, the Senator David Ige, who is our chair for the Senate Health Committee, has informed Josh, Dwight, and I that there may be a nonprofit that's also looking at funding this, and so helping fund
Wonderful.
this. Yeah.
That's wonderful.
So we're, you know,
Yeah.
he's very supportive of the resolution to move out because he thinks that will also bring more focus onto the effort. But I really commend you all for the efforts that you're doing, and I think, you know, by setting a target, it's something that, you know, people can understand and move to. So that's a terrific thing.
I think, you know, the other great effort that the Board of Trustees is doing is under the leadership of Julie Tulang, who has accepted to be the chairperson of our grants committee. Oh. And so what she's done is she's looked at all different kinds of grants that are available, and there's a group of us who have either written or reviewed grants before who are now part of her committee. And so each one of us have kind of volunteered that we will do at least one or more grants to support this effort. And so one grant is going in before April 1st for about $50,000. What we want to do is furnish the entire clinic with furnitures. This would be like chairs, waiting room furniture, conference room tables, this kind of stuff, which would cost approximately $50,000. So that first grant will be going out, is all ready to go. Every one of our committee members are either reaching out. I think one person reached out to Bob Lindsey in terms of a possibility of a grant through OHA. There's other people who have called to different nonprofit granting funding sources. And so we're working with all entities. We're not just depending on one entity to fund the whole amount, because it is a tremendous amount of money. But we need everybody's help to be able to reach that goal, because one entity cannot do it by themselves. So we're looking at the federal government, the state government, we're looking at county, we're looking at nonprofit organizations, individual donations. So it's, again, a team effort similar to our emergency room department renovations. We want everybody to buy into it, and they become part owners of this new program that we have, which is very much needed in our community. There's just too many stories that we hear of people who can't, you know, they have insurance, they have a good job, and they can't find a physician in town. And you think that, oh, if they have insurance and if they're a school teacher, there shouldn't be any problem. Well, there is a big problem. And so when this kind of people who have insurance can't find a primary care physician, you know, can you imagine other people who aren't as lucky to have health insurance being able to get in on a timely basis?
Yes, yes. The physicians we do have, they're exhausted and they're not taking any more patients. Like you said, if you do have insurance, it doesn't matter. It's a scary position to be in when you can't find a physician or medical care.
Right. But I think, you know, what you all are doing in terms of, you know, supporting what previously we had Dr. Jim Donovan and Dr. Dolan on, kind of explaining, and of course Josh Green, explaining this whole need. But you know, to see that message is going out, and now your follow-up message of really trying to have everyone come together as a community to support this effort, you know, I really, it's terrific. And so
this is a solution to the problem.
That's right.
We got to work on the problem. This is a solution.
Right.
And that's just one phase of a solution, but it's a big one. And I think we're very fortunate that we have people like Dr. Donovan, Dr. Linda Dolan, Dr. Santiago, who are busy in their work that they do, who are willing to pitch in and help resolve this issue with us, and spending the time, you know, besides their regular work hours, to be able to come out to Honolulu, to be able to go out and meet with different community groups to explain what the situation is. And we're very fortunate to be able to have that kind of physician on our island.
You know, June, I think to create the kind of success that you referenced earlier, it takes many hands.
Yes.
And therefore, you know, as you make all of these efforts, and you know, again, we all really appreciate, you know, what is being done. Public education becomes a key part of that.
And this is so wonderful. You know, this particular, isn't it?
Oh, yes.
This interview, I'm thinking, wow, this is really great because it covers the entire aspect. And I enjoyed listening to what you guys had to say together with Dr. Dole and Dr. Donovan, because it's like creating the baseline of why this is important, and it goes out to our community.
And I think it was with that thought that resolution